told you have cancer can be a frightening experience. It's a disease that affects not only the patient, but also family and friends. There's always the hope for the next great cure. And although that might not be here quite yet, Moffitt Cancer Center may be one step closer with total cancer care. Joining us now is Dr. William Dalton, whom you've always known as the director at Moffitt Cancer Center, but now as founder and CEO of M2Gen, which is a subsidiary of Moffitt Cancer Center. Dr. Dalton, welcome.
Thank you.
Glad to have you here this morning. What I'm getting from this is the cancer treatments are not one size fits all. Historically, they have been. There are only certain modalities, certain drugs, certain treatments that were available, but now you're trying to tailor it to the individual. How is that accomplished?
That's precisely. That's an excellent description of what we're doing. It's accomplished because we understand the genetic nuance of every individual. Genetics define who we are, our hair color, the way we think, the way we act, and the way tumors behave. And because we're all different, people's cancers are also different. Because with the technology that we have now, we can understand the differences and nuances of each individual and now tailor-make therapy. That's called personalized or precision therapy. So it's an exciting era. We have a lot of work to do, but the technology is here. What we have to do is study as many people as we can, as many patients as we can, to learn from them so that we can predict what will work for whom.
You already have a considerable database of patients, 80 to 90,000?
We have the largest database in the world.
And it's not, M2Gen is affiliated with 18 hospitals, several of which are in Florida, St. Joseph's, Sarasota Memorial, Watson Clinic in Lakeland, Morton Plant Meese over in Clearwater, correct, are part of this network, but you're in other states as well.
Right.
What's the benefit of that?
Well, the benefit is that we have patients that are in the community that don't have to come to Moffitt. You know, we're here if they need us. But our job is to build a technology and export it to the patient. When patients have this kind of disease, it is frightening. You want to be in your own community. So we decided we will take this technology to the community. And so we're very proud of our partnerships with the community, of which there are 9 here in Florida, another 8 in 10 different states, all enrolling patients in total cancer care.
So if a patient comes in, let's say they have colon cancer, for example, what's the evaluation process? What are you looking for to offer total care and personalized care?
Right. Well, total cancer care is more than just therapy. It's understanding of the needs of the patient and their family, depending on where they are in their journey in dealing with this cancer. Obviously, at diagnosis, we're there to understand and perform molecular technology on the tumor, understand the genetic differences that this particular individual might have, so that we can work with them and develop a protocol that is specific to them. But they also have other needs, psychosocial needs. And their survivors even have needs. So what total cancer care does is try to identify need, then develop an approach to meet that need, and actually develop an approach to predict needs so you can intervene before it actually manifests.
So yeah, there is a mental health aspect to this, certainly. If a person has a negative attitude about their outcome, that's not going to help the healing process down the road. So are you saying that part of this total care, that's part of the package?
That's part of the package. It's the psychosocial needs. And patients don't want to be alone, and families have needs. So our overall effort and goal is, again, to meet those needs, identify the needs first, and then develop an approach to meet those needs. And it's a very holistic approach.
Are we beginning to understand why certain people are predisposed to certain forms of cancer?
That's an excellent question. What we've been focusing on is treating people with cancer, but there are also predilections and where people have certain genetics and or exposures to the environment that may predispose them to cancer. And for example, mesothelioma, if you're exposed to asbestos. There are genes that individuals carry that predispose them to breast cancer or ovarian cancer. We know that now, and we can intervene before the disease manifests, having that knowledge. And so it's an exciting time. You spoke, it is a challenge when you're told you have cancer. It's very frightening. But the reason people come to Moffitt is to have hope. And total cancer care creates hope.
Traditional therapies, chemotherapy, have been very harsh. I know they've become more refined, radiation, obviously, and there are side effects that are not very pleasant. So when you can personalize the care, can you target the cancerous cells with far less consequence in terms of side effects.
That's the goal.
Okay.
That's specifically the goal. And we call it precision medicine. If you get it right the first time, then the patient doesn't have to go through a trial and error sort of approach in their therapy. That it's more effective when you know you get it right the first time and you prevent the toxicities that they may have experienced had we just done the trial and error approach. So it's better overall knowing what your target is. So it is a target-based approach.
Has it prevented some people from undergoing surgery, which, some cancers do require surgery and some don't. So with this approach, can you avoid surgery sometimes?
Well, in some cases, yes. But this is why we need to follow so many patients as possible. We have the largest database of its kind in the world, following patients prospectively. It's not near big enough. We need to learn from millions of patients, and we're on our way, and we're doing this by partnerships. We're partnering with the community, and soon other NCI-designated cancer centers will be joining us as well. So the ability to follow as many patients as you can, learn from them, so that you can provide the best target-based therapy.
You've examined or taken tissues from 40,000 tumors, is that right?
That's correct.
So that's every hospital within the network contributes to that database.
That's correct.
And you're looking for the commonalities, I suppose.
Commonalities and differences.
And differences as well.
We call it cohort identity. In other words, how many people look like me? Let me give you an example. A patient in Watson Clinic, for example, in Lakeland, is diagnosed with breast cancer. That physician enrolls the patient in total cancer care, sends the tumor to Moffitt, we analyze it. The clinical data comes into our data repository, database. That same physician that enrolled that patient can then ask, how many people look like the patient I just entered? That population will come up. What were they treated with? You subdivide based on therapy. What are the outcomes? And you subdivide on that. So that's evidence-based medicine, and we're taking it to the community where the patients reside. That's our goal. What I've just described to you is going to take hundreds of thousands of patients to be in the database.
And does everyone opt in? Do the patients have to give their permission to be in your database?
That's the way we've taken it. It's an opt-in approach. We ask patients and invite them to participate. If they decline, absolutely, we respect that. But fortunately, the vast majority say, I want in. Not only to help themselves, obviously that's the goal, but they recognize that they're giving to others by doing this. It's a very altruistic population out there that want us to learn from them so that those that follow them can do better.
Moffitt Cancer Center has always enhanced, along with other hospitals here, the medical reputation of the Tampa Bay area. Mm-hmm. And now with your new entity, M2Gen, what is that saying about our area in terms of healthcare?
I think the future for Tampa Bay in this area is incredible. What we're doing and with our partners throughout the state, and by the way, it's 9 different communities throughout the state, what USF is doing and revolutionizing approaches to therapy says a lot about this community. Part of what we're doing is also partnering with Orlando and Sanford Burnham and Florida hospitals. So these are all very good partnerships that the sum of the whole is greater than the sum of its parts. And Florida has a nucleus of critical mass and thinking in this area, and it is going to be a leader. It already is in certain areas.
And it makes it easier, I would think, to attract the best and the brightest in terms of researchers and physicians.
Absolutely. Recruiting here, I wouldn't call it easy. The best and brightest are very, very valuable, but I will tell you, we are winning. We're getting more than our share. Also helps to recruit in February and those kind of things. This is a beautiful community. Yeah. The community sells itself. But even though we're a young institution, we have an international reputation. Moffitt sees patients from 72 different countries throughout the world. So it's a destination center.
Dr. Pausang was here yesterday talking about the robotics program with the Da Vinci robot assisted surgery. Right. And when people say, well, a robot's going to operate on me? No, the doctor's going to operate. Right. It's robotic assisted surgery. How exciting is that?
Oh, it's very exciting. They're tools. And you're right, the doctors are still in control. Nothing's going to happen without intent of that physician. But to have the best tools to be able to do this is the where you want to be. And tools can be such as robots, but they can also be a computer that's giving you the best evidence, data on the best evidence of what's to do, what you should be doing for that patient.
You know, I think about someone in your position, and you're in an administrative position, I realize that, but you've been in this field for years and years and years. And I think that you always go into it with a thought of optimism, but you have to pull away at some point because you see not every outcome is going to be a great outcome. Right. How do you handle that yourself? How do you get away from that?
Right. Well, I never get away from it. But the...
How do you distract yourself from
yeah.
it? Maybe okay, yeah.
Well, let me tell you first, though, that it is such a privilege to work with the most courageous people, and I'm talking about patients. And so they give you hope, and they coming to you for hope, but they give us hope, and that's extremely important. The way I distract myself, though, I mean, everybody needs a break from what they're doing, is I'm a pilot. I like to fly small airplanes. And this is a great place to do that, by the way, Florida and the Tampa Bay area. So those are the kind of things I do.
And yet you just have to decompress once in a while and
it's one
clear
thing,
your head.
when I'm flying, that's all I'm thinking about is flying. Otherwise, frankly, I'm almost always thinking about what can we do? What are we doing in our research? And how can we do better? But every once in a while, you need a break from that train of thought, and flying gives that to me.
Well, and it must be very validating for you when people talk about the top cancer centers in the country, Moffitt's name always comes up.
Yes, it does.
Correct?
And I'm very proud of that.
You should be. Okay. Dr. Dalton, thanks for being with us this morning.
Thank you.
All right, let's go over to Kathy.